My name is João Wilson da Rocha. I'm from Angola. I'm oncology fellow at Sao Paulo Cancer Institute in Brazil. My abstract is about culture and its influence on an increase of cervical cancer cases in Angola. Cervical cancer is the third most common type of cancer among women worldwide, with approximately 80% of cases occurring in developing countries. It is an estimate that more than 166,000 women die each year from cervical cancer, and 87% of these deaths occur in less developed regions around the world, notable in the African region. In sub-Saharan Africa, 34.8 new cases of cervical cancer are diagnosed annually by 100,000 women, and 22.5 out of 100,000 women die from this disease. Angola is a country on the Atlantic coast of sub-Saharan Africa, has about 30 million inhabitants. According to data from the Global Cancer Observatory 2018, there was an increase in cases in Angola. Factors that influence increasing rates of cervical cancer in Angola. First, sociocultural factors. HPV, the necessary cause of cervical cancer, is endemic in Africa. Many of the factors that increase HPV acquisition and promote the oncogenic effects of the virus are also widespread in Angola. They include early marriage, polygamous marriage, and high parity. Polygamy is accepted in many regions of Angola. In some cultures, very young girls, usually virgins, are given marriage to much older men, some with three or more wives. The practice, this practice can increase the likelihood of a girl getting an HPV infection at first sexual intercourse. Socioeconomic factors. Women around the world with low socioeconomic status have a high risk of cervical cancer. Cervical cancer is often referred to as disease of poverty and poor women. Poverty is endemic in sub-Saharan Africa. A recent study in Mali, West Africa, showed that within a population widely infected with HPV, poor social condition, high parity, and poor hygiene were the primary cofactor for cervical cancer. In Angola is not different. Poverty, in its many ramifications, is also significant barrier to the prevention and the treatment of the disease. Biologic factors. Poor nutritional status and infections, for example, malaria, HIV, and tuberculosis, are causing many people to be immunologically compromised. Reproductive tract infections are also endemic. Recent studies associate sexually transmitted infection other than HPV with cervical cancer. Cultural, ethnic, and linguistic taboos have a major influence on the increase in cervical cancer cases in Angola. In some regions of Angola, there is a disbelief in Western medicine, medical means, and procedures, for example, vaccines. Non-adherence to gynecologic consultation, reduced availability of HPV vaccine, and the belief that the vaccines make women sterile are cited as critical conditions for the increase in cases. Illiteracy, low academic level, lack of information and sex education are proven to be sine qua non condition for the high prevalence of cases. Early age in the first coitus is one of the risk factors for the onset of the disease. In Angola, sexual activity generally starts at 13-15 years. Although polygamy is not constitutionally approved, it is practiced in all regions of Angola. There is an example of a man known worldwide with having 49 women and 160 children in the province of Namib, southern Angola. Multiparity is considered a normal phenomenon, and prostitution is common in all spheres and regions of the country. As long as the high number of low education, low income women with peer to peer partners and low discernment in Western medicine prevail, the numbers will be difficult to reverse. Thank you so much.